Imagine a place where healing begins. Welcome to Hidden Oaks, our serene 46-acre off-the-grid ranch, dedicated to guiding you on your path to recovery from addiction and past traumas. Here, surrounded by the tranquility of nature, we offer a safe space for renewal and growth. At Hidden Oaks, we understand that the journey to recovery can be challenging. That's why our compassionate team is here to support you every step of the way, providing personalized treatment programs tailored to your unique needs. Take the first step towards reclaiming your life today. Call us at 972-932-2033 or visit our website at resolutionshealthcare.com to learn more. Remember, the path to recovery runs through Hidden Oaks. Let us help you find your way. Hello and welcome to Breaking the Cycle. My name is Alan Hyde, and tonight our special guest is the author of not just one, not two, but 3 books. And we're going to dive deeper into one of them specifically, but with time allowing, we'll get into all 3 of the books here. Our first book is The Spiritually Transformative Psychotherapy. Our second book is Accelerated Ecological Psychotherapy. And his third book that we'll probably spend the most time talking about tonight is Emotional Transformation Therapy. Welcome to Breaking the Cycle, Dr. Stephen Vazquez.
Thank you.
How are you doing?
Good, very good.
Yeah. So you were sharing with me before the show started that you started developing ETT, or Emotional Transformative Therapy, in the 90s.
Yes, around the mid-1990s.
Yeah. And I kind of got a sense just checking out on your website and also reading the information that you had sent over that you are very interested in finding quick ways to help people solve complex problems.
And I am, and I'm also interested in having long-term results, not just make them feel better today, although we do that. We want a long-term resolution if at all possible.
Yeah. With ETT, what are some of the, just kind of effective ways that people are finding this long-term, kind of growth through ETT?
Many therapies that have talk therapy have some degree of success, but unfortunately, most of the contributing issues that people have are not conscious to them. So conscious dialogue itself is not enough to access those things that are the underlying causal factors, and we needed a process that would cause a person to become aware of the underlying factors that contribute to whatever their condition might be. And when you do that, you have a better shot at it lasting long term, because you're not just dealing with the surface of what the symptom is, you're dealing with the origin of the symptoms as well.
Yeah. Yeah, and I saw that this modality that you have founded, you treat anxiety, depression, complex traumas, and I imagine just so many more.
Yes, and a lot with physical pain syndromes as well.
Yeah.
So that's one of our courses, is on somatic psychotherapy, how it affects the body. I found that medicine, it leaves off the stress component of a lot of illnesses for the most part. And I found that there's scientific research that most illness and injury has a stress component. It's stress related. And basically that's just out of bounds for most people in medicine. And I find this a really key factor that makes a big difference. So we access that part.
Yeah. Yeah. There's so much more research coming out, like, the ACE assessments are just really highlighting that people are out there, they're dealing with stress, and it was nice just kind of looking over the information and getting you recommended to the show to see that there are modalities out there that can be recommended, that people can turn to, not just for kind of like the McDonald's approach, but like you're saying, this more long-term relief. I'm a big advocate of like support groups and these kind of things, but it's nice when you can find something rooted in the research, in the clinical realms, that is more than just the therapeutic relationship. And I want to hear more on this, because when I was reading your information, you did a really good job in the modality of emphasizing that therapeutic relationship intertwined through the different modalities that you've brought together through ETT.
Right. When I discovered that our attachment patterns that we get in early life with the child and the parent relationship is the basic source of development of emotional responses and of relationships, and that I decided this is really pretty important. And then I saw some research that showed that of all the factors in all the different forms of therapy, that the single most effective factor, regardless of what type of therapy it is, was the bond between therapist and client. Mm-hmm. So I want to enhance that bond, because if it's the biggest factor across the board, I want to make that work even better. And that was why that's a fundamental part of this.
Yeah. Yeah. And how long would you say, like, let's say, because you train clinicians in this, like you were saying, you have clinicians all over the U.S. and all over the world that are trained in ETT. How long are the kind of session timeframes running? Are they there for 10 sessions? Could they expect 20 sessions? What's kind of the range?
There's a long range. Let me give you a comparison example. The popular way to deal with, let's say, depression today is a person goes to a primary care physician. On the average, a primary care physician gives them a questionnaire and interviews them on the average of 3 to 5 minutes. Well, I have never done an interview that was just 3 to 5 minutes about depression. Many times, for example, the doctor's not going to know if the depression is there as the result of a dysfunctional marital relationship, or they weren't depressed until they had physical pain, or there's other factors that you have to look at that you would actually work on rather than the depression itself. And the depression, as a consequence of these factors, it changes if you understand that. And I'm not likely to get that information in 3 to 5 minutes. Yeah. And so they give them medication, and of course the success rate is about 55%. And there's side effects. We don't have those kind of side effects. We're not putting anything into the person's body in that sense. So this is like the standard of care today, is what's happening. And so they generally have to keep taking it for a long period of time, and they're only better if they keep taking it in most cases. So I wanted a process that was more interpersonal, that worked faster, and had a greater long-term effect. And I'm not going to get that in an interview that's 3 to 5 minutes. Yeah. So I think that's one place that's missing. But I mean, this is pretty much the standard of care. So I'm comparing it to that, and that's why this seems to be so much more advanced, because of the way we go about it in that way. And I'm not sure what kind of bond you build with your doctor if you have 3 to 5 minutes to talk to him.
Yeah. Getting to know the man behind the theory, and we're going to get into the theory in whatever depth we can manage in the time we have, but what kind of intrigued you and pulled you towards developing this theory and saying, was it just you woke up one day and said, hey, look, the world needs this, or was this like a passion project for you?
It is a passion project. It first started when I met some optometrists that were using various forms of light and color to change vision problems. But I noticed that when they were working with them, certain emotions would evolve and come forth. I was interested in that part of it. And so I began to experiment with using it with people who came in for counseling of various types. And I gradually, over a period of time, began to develop a system. And it has evolved dramatically over the last 25 years to where what I'm doing today doesn't even resemble what I did at the beginning. But I saw that we could speed up things and go deeper into the sources of the causal factors and have bigger changes. So I'm not interested in another therapy that does the same thing as other therapies. I want something that goes beyond what is already out there to use. And so that was my purpose, my quest. And when you listen to people suffering every day, it motivates me to find a better way. And I wasn't satisfied with what I knew in the 1990s, so I was just motivated to find a better way. One traumatic event after another would be destabilizing for most people to hear, unless you got answers, and they got better. Then it becomes invigorating, and that's what it's like for me.
Yeah, and it's refreshing, right? As a clinician who's bringing people onto this platform, it's like in the modern age, the advent of social media, you can pop on, and for those watching, I'm sure you've had these experiences too, where you can find someone creating modality anywhere. What I appreciate about you is that people aren't going to find Dr. Vazquez all over social media, but when they find your information, they're gonna see the research-backed. People are trained in this modality is working, and what I like about it is that there's some really unique things. And I made some notes here because I wanted to make sure, just for my own edification, while I have you, that we touch on some of these things. But there's some unique things about ETT that keep it from being pigeonholed with other treatment modalities. And I want to hear from the master himself while we got you here tonight. But ETT integrates advanced eye movement, which is similar to other theories, but this is where it gets interesting, with wavelengths of light and frequency while processing emotional disturbances. This is what I was intrigued by, is ETT is the only psychotherapy method that combines 4 unique modalities. So for those listening, it's multi-dimensional eye movement, spectral resonance technique, peripheral eye stimulation, and light and frequency. I want to hear more about all 4. The light and frequency is where I'm kind of like, I was nerding out a little bit of like, I'm very excited to talk to you about it, but I'm curious just if you could give us a snapshot of how you started to find these 4 aspects fitting together.
Okay. There are over 1,000 research articles published on the effects of light on the brain and specifically on mood states. Particularly in the area of seasonal affective disorder, or what some would refer to as winter depression. However, what happens with that type of work, it is a form of self-work. You sit in front of a light, and they devise lights that would help with the moods. But let's say you have depression that occurs in the wintertime, mainly people in the northern part of the country, like New York, Alaska, Seattle, those kinds of areas. And so it's useful, but what happens at the end of the season, it comes back. So then you have to do the same thing the next season. In other words, it doesn't cure the problem, it palliates it during the affected season. And so there's lots of research on how light affects the brain, and I wanted to combine it with the interpersonal component. What's different about this, it's not just using light and color, and it's not just talking. It is the unique combination of them that we get this profound change that we get to see. The modalities, I started using a light device that was originally used by these optometrists that were sort of renegades in their field, and so I developed that first. But since I developed in the mid-1990s, it's 2024. We've gone through 8 different light devices, each one of them more technologically advanced than the other. We had 8 or 9 colors to start with. Now I have options over 16 million variations of color wavelengths of light. So that's that device. The eye movement one was I first read Shapiro, who founded EMDR, her article, first article was published in 1989, and I wasn't trained in it. I didn't know how to use it, but I was in a group. I had read this on the way to a training that I was going to do. So, I wasn't knowledgeable about it. But a gentleman in the group, suddenly at one point, he had a birth trauma that emerged. It was pretty strong. And so I experimented with getting him to move his eyes, and he got better. But that wasn't enough. I still wasn't sure about this eye movement business. So I saw him 5 years later when I was back in San Francisco again. And he told me that he had where your what is it called, where your bones wither away, that condition, and he said it stopped when I worked with that trauma with him. It stopped completely. I had no idea it could do that. Here's the story. It turned out that he had a traumatized birthing experience, and around age 40, it was reactivated. And when a child is born, their bones soften, and the mother's bones soften for it to take place. And he got traumatized in that phase, so guess what? he has a condition where his bones would soften. And they tried all kinds of other conditions, other treatments, and nothing worked. And we did that in one session. So that captured me. I think, okay, there's something to this eye movement. So I explored eye movement. I read all the research I could read, and I came up with a way to do it. But I developed that before I knew you could get trained in EMDR. And I actually went through their training. But by that point, what I was doing was far more effective than what I learned in the EMDR training. So I just continued with what I was doing. That's how the history of that story took place. Then I developed a method called peripheral eye stimulation, which is very profound. There's a long history in therapy working with certain parts. Right now, there's the internal parts model. There's all kinds of models. Freud developed the id, the ego, and the superego. So we've been looking at parts in therapy for a long time. But this is different. I mean, by stimulating the periphery of the eye at a specific angle, it brings out a specific psychological part. And another angle, another thing comes up, and you begin to explore the whole repertoire of what's going on inside this person. And we change pain like in minutes with this process. So it's particularly good for pain, but very good for psychological issues itself. It helps you access these inner parts. Parts that are very somatic in some cases, where physical pain is in one part, you find another part there's no pain. And so the thing just has grown to where there's so many things we can do with it. That's just a brief overview.
Yeah. We had a gentleman on months ago. He was sharing his background with brain spotting, and there's a quality of it, right? That just, I want to be clear too for those listening who may not catch all the nuances. I know we have clinicians who join us week to week, but you're being modest, first of all, right? This gentleman's modality is accepted worldwide, and just as in the brief time that I've looked into it, it's clearly working for people. And there's so much I want to get into with you, but I really want to highlight for those listening, if these are things where you're wondering, why do I have kind of let's say a seasonal issue that comes up, or this undefined struggle that I've had for a long time, this could be a modality, someone trained in your area who could help you figure some of these things out as to why it hasn't been treatable before. And in my 12 years, I mean, I can't tell you how many times I've heard of that, of like the traditional talk therapy. For just some people, it's not working out. And finding some new creative ways to approach the problem is what was needed. And so it's refreshing to have you come on and to hear about this. And I'm enjoying learning more about this as I've read your information. And so, yeah, it's just really cool. I'm blessed to have you on tonight.
Thank you. At some point, I'd like to share some of the things we've developed, specific protocols for specific conditions that were not done before. Would this be a good time?
Yeah, absolutely.
I discovered a way to treat ADHD without medications where we completely eliminated long-term in 3 weeks. There's a 3-week regimen we use, and it literally changes it to where the very first person I tried, she said before the treatment she had maybe 30 things to do in a day, and she may have accomplished 1 or 2 of them. After the treatment, she said if she had 30 things to accomplish, she got all 30 of them done. This was in 3 weeks. She was open to experimenting with that, and I developed a process with her. Then I repeated it with numerous other people, and they don't have ADHD anymore, and there's no use of the medication whatsoever, which is a radical statement to make because it's not been known before that that's even possible. So that's one regimen.
Do you have assessments that you're developing on these things too, that as you're just finding? Yeah.
Yes. In this particular case, we haven't published it yet, but we've sent them to an expert on ADHD to do a very thorough evaluation, because it varies from one person to another, their type of ADHD. And but it just hadn't been done before. So I'm helping a lot of people get off the medications that they're on. As we see this is working, we reduce the amount of medications, or I collaborate with their prescribing physician to let them know that they're improving and maybe they can reduce them, and we end up getting them off the medications in most cases. So it's a different concept from those doctors that you don't have to just keep taking them. But if they're getting better, you have to at least adjust the dosage or whether it should even be on it or not. So ADHD is one of them that we have a complete protocol for that's been successful over and over again. And it's so fun to watch it because people are, some describe it as a spiritual experience. Others just, it's like it's a radical departure on what they've experienced their whole life, and it's just odd for them to be able to focus and not be scattered. And so anyway, I get excited when I talk about it.
Yeah, it comes across, and but it's interesting because I was talking with a client earlier about it, of like just the piece of the therapeutic relationship. That's my bread and butter. It's always been where I've landed. It's why I do stuff like this. I enjoy the conversation, you know, and watching an individual just connect to that relationship, process better, and then have that departure from what they've known for so long. Watching that transition is exciting. And it can be scary for some, like you were touching, like some people don't know how to handle it. But it's nice. You have a protocol for it. You're walking people through. Are you using let's say with ADHD, are you using all four aspects of?
No, the light device is superior for that particular condition. Other conditions might use a different modality. And sometimes the idea of having four modalities allows us to individualize it. One modality that doesn't work for someone, we go to another one. And so we have four choices there. We're going to find something that fits. For example, with the light device is extraordinary in its effect, but for some people it feels overstimulating a bit much. And so fine, we don't have to do that. We have other options that we can go to. Some people vary in the way they respond to visual stimulation. Let me just say that the nuts and bolts of this is that we access what are their attachment patterns so that we can respond individually to each person's attachment pattern and help them bond in a way that they haven't before. But this has to be done while the visual stimulation is taking place at the same time. And with the visual stimulation, it's gotten to where in many cases we can access specific brain mechanisms related to that condition and change them. And the essence of it all is called emotional transformation therapy. What we do best is change disturbing emotions that people bring in. And of all the diagnoses that are in the DSM-5 that list all the different diagnoses, the vast majority of them are emotional symptoms in general. And that's what we do both. I thought that was the heart of what needed to take place. And so this is all focused on changing emotional states. And then the belief here that we've seen is that when you change the disturbing emotional state, their physiology changes, their cognition changes, they think differently, if they're no longer scared to death or feel guilty or whatever the emotion might be. So you have behavioral change, you have thought change. And so a lot of therapies go after behavior and thoughts and so forth, but to us, it's a consequence of you've changed the emotional state and the others change. That's the core issue in many cases. So a lot of times people, for example, they think negative and they want to get out of it and they're depressed, but sometimes you can correct the thinking, but the emotional distress is still there.
Yeah.
And that's what we go after.
Yeah, I wonder what that was, where, because you can see it in the literature too. There was a real shift from kind of base theoretical Freud right into Jung, and you know, where the field's being developed, and then it became very cerebral, very cognitive, while the symptoms were very emotional. And you see that a lot even too in some presentations, especially among men, where the reports of their symptoms are often, you know, logical cognitive symptoms, but what they're trying to communicate are emotional areas of distress and trying to get clients there. I'm not sure what happened in society, especially in our field, where like some of those turn. It's very academic too, you know, you can describe the cognitive part a lot better, but it's interesting, you know, because your modality brings it into a place where we can understand that these are emotional symptoms and there are multiple ways to address it. And then by doing that and adding in just these interesting little components, you see people's demeanors shifting, symptoms resolving. I've always been really intrigued by EMDR, but I'm curious just kind of your thoughts as you, because for those listening, Dr. Vazquez has been practicing for coming up on 40 years.
Over 40 years.
Over 40 years, yeah. So you've watched some of these shifts,
Yes.
and I'm curious, just because you developed this in the 90s, how you've navigated that ship of the field kind of changing and staying with this vision of like, these are emotional symptoms that we're treating.
As far as EMDR is concerned, the vast majority of people that I train have already been using EMDR and are trained in it. And most of them have given up EMDR for this method. So that's the only comparative testimony I have, is that the practitioners themselves don't use it anymore after using this. And, when I do comparative studies, I'm just telling you what the feedback that I'm getting with that. We have more flexibility, more options. Anyway, trauma is one of the main things I work with. And if a person has complex trauma, it's not just a trauma. It is the marriage broke up, somebody died, multiple things have gone wrong and have just accumulated in a person. So for that reason, that's why it's important to be able to have a way to shift the emotions quickly, because otherwise they'll be in therapy for years because they have so many things wrong. Their parents beat them up when they were a kid. They've been divorced twice and broke their hearts both times, and they've had surgeries because, they had a car wreck or whatever. I mean, the histories are amazing that they're still alive. So a lot of what I get is people who've already been through everything else, and I see them last in many cases. I'd love to see them earlier, but that's what happens. I'll give you an example. One woman I worked with when I first moved to Austin, she had been in a car wreck, and the car caught on fire. Her husband died in the car wreck. Her child was injured. She was burned and had 32 of those surgeries for her skin to get it back. She'd been in therapy for a year, and she was sent to me. She was pretty much at a standstill in therapy, and we did it in 5 sessions. The trauma was over, and she went on her way. I mean, that's just an idea of the kinds of difficulties that I get to see and help, and that's exciting. And then when this happened, then I got more people sent to me when they heard about this turnaround, because it was pretty drastic, if you can imagine. And what could be worse than catching on fire? Your spouse dies, your kid's injured, and you're having multiple surgeries every month to correct the skin graft surgery is what I'm talking about. Anyway, so that just gives an example of some of the things I see.
Yeah, and there's that intersection even in that example you give of like trauma oftentimes has the complications of grief and loss, life transitions, just the complexities of all the reasons that someone would come to therapy and to see some of the distress being resolved quickly. I would imagine that's why a lot of people want to go to therapy in the first place. Resolution to the distress. When did you start noticing, was it pretty quick when you developed this modality that you started noticing that people were getting better? Yeah,
I experimented. I asked their permission. They wanted to come in and talk about their issues. So I said, would you mind looking at this light while you talk about it? And I hit and miss at first, but then I got some pretty big hits where people changed pretty rapidly. And then, wait, there's something to these different wavelengths of light. And I had to figure out, I must have worked with 50 people before I figured out a system as to which wavelength of light was most effective for which type of condition. So it was gradual at first, and then the system got more and more precise over time. And now it's like super precise. Basically, they can tell me an emotional state, and it usually shifts within a couple of minutes. And then they tell me another emotional state. That usually shifts within a couple of minutes. But we do enough of that, and then there's a larger shift in their basic function. Now, one of the problems we do have is called cognitive dissonance. I call it the lotto effect. People that win the lotto, you'd think they would be really happy, but the research says that by the time they get their last installment, half of them have gone not well financially, sometimes bankrupt or whatever. So there's an adjustment to a rapid positive change. So I'm thinking, God, I spend my whole career trying to cure these things, and then the people can't handle them because it's too much, too fast. So then we have to build that into therapy. How do you adjust? You've been depressed for 40 years and you're not now. Things change. It gets difficult. I'll give you a specific example, if I may. A woman came in. She was depressed. She was on an antidepressant, and she wanted to get better. Okay, she was married, so she came in. I asked her, "How depressed were you before you took the antidepressant?" She said, on a scale of 1 to 10, she said 10, and I was suicidal. How depressed were you after the antidepressant? She said 8, and I was not suicidal. So in 5 sessions, we got her to 0. Now that was spectacular, but she needed to downsize the medication because, if I took depression medication, and I was not depressed, I would not feel better. I would have symptoms of inappropriate medication. But so she goes home, and her husband, she wants to go dancing, she wants to go out to dinner, and he's going, no, I'm not ready for that. I had to tell her, he didn't go through therapy, you did. And so he was used to living sort of a separate life with her because she could never want to do anything. And now that she was alive and better, there needed to be some adjustment. So I told her, you're going to have to be really patient with him. For years, he's been able to cope with you not functioning very well, and now you are, and he's not going to turn around immediately. It's going to take some adjustment time. So that's an example.
Yeah, it's a lot like the 1 in 10 in the 12-step recovery rooms, where 1 out of every 10 alcoholic is going to get recovery. But when they do, and the loved one is still around, and all the adjustments of that new sober partner, depression is very much like that. When someone lifts out of a depression and they've been there for a long time, and their partner's like, who is this person? And that's why, to connect it back, just getting to know your theoretical background, that's why that therapeutic bond is so important, to kind of make sure that as those shifts are happening for the person in therapy, they can then also detach from the way everyone else is going to experience them too.
Yeah, it's an adjustment.
Yeah. By the way, how are our lights in here affecting you? Were they the proper choices?
They're probably not, but it could make a difference because, see, when Edison invented the light bulb in 1879, essentially our whole world went through an adjustment to different lights. We began to have indoor lights a couple of decades after. Well, there's been measurements. These lights can be destructive to a lot of people's health. Depends on what they are and so forth. So now you can get full spectrum lights that are healthy, but people don't understand its impact, and I think it's big. So one study where they had families go camping for 2 weeks, and you rise when the sun comes up, go to bed when the sun goes down. Their whole rhythms changed because there's a part of the brain called the suprachiasmatic nucleus, which is some people refer to as the biological clock. Well, this biological clock is on the hierarchy of all of your glandular functions. It's the king of them, so to speak. And so if you correct that, any number of other things get corrected in the body. And we're not used to natural light. What happens in Texas, for example, is there's some people never see it because they put their sunglasses on the minute they walk outside in their sun, and they're under artificial lights all day. And then they have various malaise that doctors can't quite fix, but they don't recognize that it's the lighting that could be a factor. I get carried away with that subject, so stop me.
Yeah. Well, and there's a piece, obviously the clinicians who listen week to week, they could go and get your training if they want more in-depth on this. And, the people who are listening who aren't clinicians could go find someone trained in it. But while I have you, when you are doing the light work, the light refraction and those kind of things, are you guys finding like a shade of the light that feels comfortable to meet the symptom, and then changing it as the session goes?
Absolutely.
Okay.
That's exactly what we do. When you have over 16 million choices, you can actually get the exact wavelength that's going to affect that particular symptom in most cases, and it does it fairly quickly. As quickly as that fell.
Yeah, bless my heart. We'll roll with it. The lights are rolling. We're good.
Okay.
So, is there lights or colors specifically that have been found over and over to work with specific symptoms?
Absolutely. Would you like a few examples?
Yeah, I'd love some.
I did a demonstration once. I asked them to bring in 3 people from an inpatient facility that were all addicted, and they were in the midst of craving. I used one specific wavelength of light. The first one was alcoholic. In 15 minutes, his craving went to 0. The second one was methamphetamine. In 10 minutes, her craving went to 0. And the third one was heroin. And in 10 minutes, his craving went to 0. I'm not saying we cured them. I'm saying that we could eliminate the craving that fast. I discovered the exact wavelength that would affect what's called the orbital frontal cortex, which is above and behind the eyes. It's dysregulated during during addictions, to where it affects your decision making. And specifically, it's seen in alcoholic groups as it's called stinking thinking, how they do not think logically. That part of the brain is compromised during the addictive neural network of the brain, and I actually found the color that would change that I'm not coercing them. I'm not telling them you need to stop, this is terrible, and so forth. I have them talk about their craving, and in 10 to 15 minutes, it goes to 0. And it's temporary. We have to do it every session to make sure. I don't want them to use between sessions, so we do that. But that's an example where I actually found the exact wavelength that did that, which looks to most people like an indigo type of color, not blue, not red. Very specific indigo does that. And there's others that I've discovered specific wavelengths of light for specific conditions. I am doing a presentation at the American Marriage and Family Therapy Association in November, and my title is When U.S. Politics Divide Families, which is a pretty hot topic right now.
Well, it's the perfect time of year to start having that conversation.
I'm going to do it like 2 days after the voting, actually, because family members are not talking to each other. Some of them are cursing each other out. Some of them, it's destroying a lot of harmony that was in families. And I found some wavelengths of light that would change that dramatically, to where the example is one woman had, she was going to go visit her relatives in another state, and she was on one side of that political viewpoint, and her family was on another side. And not only were they on the other side, but they were in your face on the other side of the political spectrum. And so she wanted to go home for the Christmas holidays, but she dreaded to go because she knows she was going to get confronted. So I worked with her about 15 minutes in front of a group, specific wavelength of light I discovered does that. It neutralized her to the point where, she still believed her position, but it didn't bother her that other people had a different position. My own dream is to do this to the whole country because it's such a big problem that politics didn't used to be brought into therapy. It's affecting people where they're coming in talking about, my dad doesn't talk to my mother anymore because they're on different sides, and some people move. I've had some friends that have actually moved to a different country, Mexico specifically. Some people have moved to different parts of the country because of their divide. It's a horrible thing that's going on. And it's thrilling to me to find some way to bring peace and acceptance to that kind of a problem.
Yeah, it's definitely in the last couple decades become a very significant issue. I've heard many clinicians. The clinician coming on next week, he wrote a book on, the political divides and how to do this, have these conversations. But it's interesting. The clinicians are having to sit down and tackle this unique problem because it's not even about politics anymore. People are ripping each other to shreds emotionally, probably because of these symptoms in here and the way the brain is reacting.
Yeah, I've identified as an approach avoidance. As people that they love, but they hate them temporarily for what, and sometimes political reasons, but maybe it could be a religion, whatever it is that is a big difference. And so it's really wonderful to bring peace to people's minds about that in this short period of time. And because that's a common issue in family issues, is that the person you love, you also detest in the same way. So we call it approach avoidance, and I'd look up all the brain research on approach avoidance, and we found a way to actually settle it pretty quickly.
Yeah. Well, and I think it's a good a time as any to kind of tie back in that attachment base of the work that you're doing. And it's like, if you've ever spent any time working with kids, you know that it doesn't take a lot of work with kids to make a pretty big impact, and the interesting thing is, let's say like attachment theories or even like inner child type work. It's like when you get in touch with that part of yourself, some quick work can start to happen if you approach it properly. And it sounds like you've found some out of the box ways that you've been able to describe to get into that place.
Yeah.
Whatever's going on there.
And they're very consistent. These aren't like every now and then it works. They're pretty consistent if done correctly. And that's just thrilling to watch people reach a sense of peace when they were not at peace at all when they walked in the door. Last week, a woman was completely suicidal when she came in. My first session, first time to meet her. By the end of the session, she was not at all. In fact, she felt hope and joy. And doesn't always go that fast, but this is fresh. Just last week, this turnaround, I got to see this, and I leave my office exhilarated when you see something like that happen.
Yeah. Well, I think there might have been a time years past where, and you could speak to this better than I can because you've been around in the field longer than I have, but where people with the EMDR stuff, like, whatever. Now it's so clear that EMDR works quickly. If you're, utilizing theories like ETT, and the research that you have on it, these things are available to you. They do work quickly. And if you're seeking these kind of treatments for your distress, where can they find your information and therapists that are trained? I know where to find it, but if you want to plug that, we can make sure that we
website,
get it.
At the moment, I'm not remembering exactly what the website
is it the ETT one?
Yes.
Was it your last name on that one? One of them had your last name. We can find it. We'll make sure at the end of the show, if we can't get it right now, that we get it in the comments. Okay. Because wherever you are in the U.S., wherever you're watching from, you can find someone who's trained probably pretty close in your area.
I should have brought my card that had that on it, but I'm so intrigued with the complexities of sharing that I forgot something as simple as a card. So marketing has not been my strong point, but we're working on it.
Yeah. Well, this is a good step in that direction.
Yeah, I think so.
Yeah. So we'll make sure that we get the website. I have it somewhere. Even the ladies might have it. We'll absolutely get it in the comments so that they can find you and the clinicians that you've trained. You mentioned that you have a seminar coming up, but let's say a clinician was listening tonight and they're like, this sounds interesting. Where could they, on the same website?
Same website. It has the list of courses that are being offered in the next few months and where they're being offered. Some in California, some here, some maybe in Colorado. There's different places. We're not all over the country, but we are primarily Texas and California and a few other places. We're starting some people in Colorado to get trained, so we're expanding in the process of growth.
And how often are you still doing like the bulk of the trainings?
I have like 9 practitioners that are trained to do the courses. So, and I can't do everything. So I try to do the ones that are in Austin, Texas, where I live. At this point, my age, I'm not crazy about traveling that much.
Sure.
But I traveled here, which wasn't that far. But anyways, that's why I have people located in different places. Or if there's enough interested people, let's say in New Jersey, okay, you got 15, 20 people, we'll find the teacher to go out there if that's what the interest is. And so we can take them wherever we get interest, and we're trying to get the word out about it.
Yeah. Yeah. Where are you finding kind of like, is it conferences or just other kind of networking events that you're...
I present at a lot of professional conferences.
Yeah.
I think I listed over 60 of them that I presented in the last, 30 years or so. So that's probably one of the main avenues. Locally, I do some introductions to some groups of therapists, locally in Austin, I meant. So I've hired a marketer. We're just beginning to get rolling on the marketing. And I'm so fascinated with if it was up to me, somebody pay me a salary, put me in a room, just give me all these different clients, see if I can create a way to solve that. I enjoy the creativity of solving problems that haven't really been solved before, or not quick enough, or whatever. I just love to do that. So I'm interested in the creative part of it, and the exhilaration of seeing people get better. Basically, I'm on the planet to heal people. That's it.
Yeah.
And and I'm always looking for better ways and new discoveries all the time. So there's other specific conditions we've been very successful with that we haven't seen research elsewhere that is accomplishing that. For example, obsessive compulsive disorder is a tough one for a lot of people.
It's a tricky diagnosis, yeah.
And we have a specific protocol that usually works, not 100%, but the vast majority of the time. There's, of course, depression, anxiety disorders, but I probably mainly work with complex trauma more so than other things. And I do a lot of physical pain things, things that I was so ignorant I didn't know it was incurable when I got them, but then we got them better, so I'm glad I didn't know that at the beginning. So there's a lot of like back pain issues that we do really well with. Yeah. Because pain, what people don't understand is that if you can change the brain related to the pain cycle, you can change the physical pain without manipulating or touching the person's body or doing any of those things or medicating it. But if you have a way to effectively affect the brain, that's where the pain starts.
Yeah.
And if it doesn't participate in the physical pain, you're not likely to get there.
Yeah, and you had made mention before, and we would need so much more time to go into somatic experiences and healing. But there is a massive part of the brain that plays a role in your somatic pain. And there's all kinds of accounts of people who have these chronic pain issues that they come in, they resolve the distress, and the chronic pain is gone. And that could be as small as an unconscious way you're holding your posture that all of a sudden shifts when you've processed certain things. The human experience is very fascinating, and I'm sure you and I could go round and round and round. But as we come to the close of our conversation tonight, I have some questions that I like to make sure that I ask our guests that are a little more fun and creative.
Okay.
We'll see if it helps people heal. I don't know. We're just going to have a good time with it. But if we were going to create a mental health amusement park and you got to build a ride there, what would be the ride that you built? Why would you build it? And what would you call it?
Well, this emotional transformation therapy, what I'm doing, of course, because I think that emotions are the key to changing most mental health problems. If you can master that change, it can divert to any number of conditions that are stress related. And if you can change panic attacks in a couple of sessions, which I do, I mean, I get people that have had maybe over 100 panic attacks. And so we got to change that whole pattern in that case. That's with the anxiety. If you can change any number of mental health conditions quickly, my amusement part would be loaded with ETT available to each person that wants it.
Yeah.
Sleep disorders, work with sleep disorders. A lot of people don't realize that the brain needs light in a certain way in order for sleep patterns to change, to get your circadian rhythms in sync. And so I work with a lot of sleep patterns. Sometimes sleep disorders occur as a result of an anxiety disorder that they've had during the day, and sometimes it's solely a sleep disorder that's separate, like sleep apnea is separate. It doesn't matter what you do during the day, the sleep apnea tends to still be there. But it's usually some unresolved emotions that cause people to toss and turn at night. And if we can find the connection, which one of those can make a big difference. I'll give you an example. Right now, a lot of people go to their dentist because they have TMJ, chronic pain in their jaws. Usually starts when a person is clenching their teeth or grinding their teeth, often during the night. So what the dentist is left to do is give you sedating medication that will calm you down, or giving you guards in your teeth so your teeth won't wither away, or eventually make an implant for some type of severe joint problem in the jaws. But what they're not doing, they're not eliminating the clenching or the grinding of the teeth. Dentists aren't trained to know how to get to that. We are. We can access what is the stress factor that's causing them to grind their teeth or to clench their jaw. It's usually not conscious to them. The idea of the unconscious is not a part of medicine generally. They don't get that unconscious factors can contribute to physical things. And this is an example. And so, like one gentleman I know, he grinded his teeth every night. He changed jobs, didn't grind his teeth anymore. He accidentally stumbled upon what the stressor was that was causing him to do that. But since it's not conscious, you can't just ask them, why are you grinding your teeth? They won't know. Yeah. But I've found several things to cue me in on that. So we've been able to change that. And if you think about your dental bills, how much money it would save you to eliminate the clenching or the grinding of your teeth. That's just an example of how stress is related to physical pain. And, dentists are just working on the far end of the deal. Okay, your teeth are already withered, your jaw is already in pain, and you keep clenching. So they're fixing it so that it doesn't happen in your mouth as much, but the clenching is still there, and the grinding may still be there. Yeah. Anyway, I get carried away with that one because it's exciting to see it change.
Well, these are multi-dimensional, right? You can change the symptoms, but if you don't get to the root, maybe that would be the theme of your aspect in our mental health amusement park. If you go over to ETT, you're getting to the root of the problems. If you guys have more questions that have arisen from the conversation we have had here tonight, there's plenty of literature that Dr. Vazquez has written. But I just want to thank you for coming on tonight and joining us here and sharing your insights.
Good conversation, good questions.
Thank you.
And there's much more.
Yeah, absolutely.
After 40 years, you can imagine how much more there is. A lot.
Yeah.
So I appreciate it very much.
Absolutely.
Thank you.
Ladies and gentlemen, we break the cycle here every Friday night at 7 p.m. We will see you next week. God bless.